everyone. Welcome to Doctors on Doctors. It's our second episode, and I've got a very, very special guest with us. Welcome to Dr. Prathik. He is an orthopedic surgeon specialized in arthroscopy, joint replacement surgery, and a big specialist on sports medicine. Welcome, Dr. Prathik.
Thank you so much, Dr. Lahari, for having me over here. I've been looking forward to be a part of this Doctor on Doctor podcast, and I think let's see what's in store for us.
I've got a lot of questions, none of them academic, everything personal. We decided to do a podcast like this just because I feel like whenever I see patients in the clinic, we don't actually get to see the behind the scenes of the doctor's life. We just know that doctors have just slaved their 20s away to study and now just, sit in front of us in a time where we need answers to questions. And I feel like it really helps to give that personal connection to the patients. And it's important for them to see, what are we like behind all of the doctoring. So let's start with, what is sports medicine?
Sports medicine, it's a very upcoming branch of orthopedics and very important branch as well. So it's just not people usually misjudge that it's only for sports people. Yeah, it's primarily for sports people, for athletes, but also for all young people who are into active lifestyle, people who are into gym goers, everyone. Okay, so we deal it's an array from preventive injury or preventive sports medicine to surgical. So we deal with all sorts of ligaments, all sorts of meniscus, primarily shoulder, knee and hip. We also have small joints, that's elbow, wrist and ankle as well. So why do a patient need to come to us? Like a sports medicine certified surgeon is very important, because if not, it just doesn't end with surgery. A proper rehabilitation is also very important, and that's a whole process. And once that is done, you need to be as good as what we call as return to sports. And once that is done, you're good to go.
So if my kid is playing sports, then they should always kind of mark out a good sports medicine doctor beforehand, or do you only come to see a sports medicine doctor if you get injured?
That's a very good question, actually, because always prevention is better than cure. I think we've always been taught about that from childhood. So it's always better you go beforehand. You know that you're being treated exactly, the right set of muscles have been strengthened. You're been doing the right set of exercises. What are the do's, what are the don'ts? Because always how do we do? I'm sure we all are very active individuals. So when we go out, to gym or Pilates or whatever, we've not been told what exactly is right or wrong. You have an hour of session to do. Nobody sees whether we're doing the right warm-up. Nobody says we're doing the right cool-down. So that's when our team, when I say sports medicine, it's the sports, physician or a sports surgeon. We have a set of physiotherapists. That's a huge chunk of our team. So we guide you on how to deal with it and how to overcome and make sure you don't get injured.
So you've got your own kind of team of physiotherapists?
Yes. Out of Bangalore, right here, I have a whole team of physiotherapists who are located in all across Bangalore. So because, if you have to survive, I can't expect a patient to come and meet my physio.
Well, not in Bangalore hospitals, because you have metro connectivity everywhere.
True. That's actually that's one of the main reasons, guys. When I said yes, I need to come back to Bangalore hospital, the connectivity was bang on. So that's the reason. So but on a serious note, so we have a lot of physios all across. So North Bangalore, South Bangalore. So it gets much easier. And they're all sports, physios. They've been well trained. They've been associated with most of athletes and all of them. So it gets much easier.
Yeah.
So yeah.
So you would say that the best way, I guess, I'm thinking of putting my daughter into basketball. I used to play basketball, and when you kind of sprain or injure or whatever, your shoulder hurts, you don't really think much about it, the kind of effect it has on you later. Even now I've got shoulder pain and things like that. So would you say when I'm thinking of joining my kid in a sport, I should find a doctor. Well, obviously my doctor's you, but like, yeah, I would find a doctor and like say like, hey, my kid's joining sports. What's the safe way to do it? And then have you, be under their care.
So basically, Lahari, what I suggest, I tell all my patients, all my friends and family that, that don't neglect a pain, okay, whatever sort of pain it may be. So we're so used to, just putting it behind the doors and say that, okay, it's okay, let's go ahead with it. Because every micro trauma is going to lead to injury, and a major injury, when it's irreparable, then surgery is the only option. So definitely, if you have a acute injury or a major twisting where your ligament is broken, then definitely you come to us, we're going to fix it. But these minor trauma or micro trauma, what we call, so it can easily be, fixed if you come at the right time, or if we are in the loop and help you with that.
So pain's not just like a pain. There's actually some structural issue happening whenever, like, let's say I'm walking, like literally when I was sitting right now and I moved my chair, I could feel my knee. I was telling you that I feel like my knee kind of twisted.
Twisted, yeah.
So what do you do in that situation? Can I just like shake it off, or?
Pain is never just a pain. I mean, that's one thing.
Yeah.
That's like a misnomer. We've been like, I have seen so many of the times, so it's like, when patients come, even in residency, they should be like, doctor, it's paining. And there are people who's like, it's okay. Pain is very normal. Pain cannot be normal. So pain is associated after surgery. Yes, that's a surgical pain. But if you're walking, if you slept in a wrong, posture, and you get up in the morning, you have a sprained neck. I think, I'm sure you have that. And then, if you say that it's paining, let me just, I said, yes, I think, there are so many other things, but we need to know the root cause. Okay. So if it's there for a day or two, please, get it checked. I'm not saying, investigate it, but you need to know the root cause and make sure it's sorted.
Just have your guy.
Exactly.
Have your doc.
Exactly.
Yeah. And then they'll just help you out.
True.
Speaking of residency, both of us actually did train together in our very initial days of learning how to be a surgeon. And then I went on to do my fellowships and he went on to do his fellowships. But we have a lot of good stories for later. So, you know what I find interesting? Like, sports, when you say sports medicine, people think it's like basketball or badminton or soccer, whatever. But like, according to you, what is a sport? Because you were saying like even our gym or Pilates or whatever requires, sports medicine doctor. So according to you, how would you define what is a sport? Okay.
So sport is a very subjective term. I'm not going to open the dictionary and tell what it means, but it's, any sort of, mental or physical rehabilitation, what you do is a sport.
Okay.
So that might be, all the, soccer, all the ball games, and maybe gymnastics. So we have all the new set of things, pickleball, paddleball, all of them as well. So even Pilates, all of your aerial yoga, working out, calisthenics. So all of them which requires your mental and physical, together. It should be in sync. And so whenever you're doing all of this, so your muscles are in complete motion and they go through this micro trauma. So that's why your muscles are sore the next day when you work out, and you get that pain.
Oh yeah, what is that? Why do you get sore?
So that's basically, it's as simple as that. So when you do your upper body, so you're doing your heavy weight, so even you're doing your cross body workout, so your muscles are getting the small micro injuries, so which is causing the pain, and then that is there is revascularization. So I'm sure that's a very scientific term. So there is growth happening there. So then with adequate nutrition, so you are building up muscles.
Okay.
So it is just not a one-way street.
Okay.
So it's got to be all together. So as much as it's important for you working out, it's very important for you to warm up those muscles. Much more important to cool down, because you just can't be holding the muscle with weights and with doing all sorts of activities and not cooling it down. I mean, you're of no use. So that's what is important.
Yeah, my treadmill always tries to make me do a cool down session. I just like end it right away and walk off. So no.
Now you know that after this podcast, what is your take home? One of the take home messages. So
So, okay, I heard that, when you were in Pune, you worked with a bunch of big sports stars. So, do they follow all this strictly? I mean, like, I heard like sports people work out for like 2 hours twice a day. So, they do the whole, what is their warm up and cool down? How do they protect themselves?
So, Larry, it's a very interesting story actually. So, as you were just mentioning, so I was after my residency over here,
Yeah.
I was always inclined towards sports medicine, arthroscopy. So, I was with my boss. His name is Dr. Sachin Tapaswi. He's from Pune. So, he's one of Asia's leading, sports surgeons.
Yeah, I've heard of him.
So, we deal with a lot of sports stars,
Yeah.
a lot of them.
Uh-huh.
So, when there's no injury, they're damn good. I mean, they're the best people because they're always with, they have a whole team.
Yeah.
They're the physios, they're doing it. So, they come
So
to
they've
us.
got their own sports medicine team.
Yes, they have a
Okay.
team.
Okay.
So they go on field, in field there with them.
Okay.
Okay, so it's all sorted. But God forbid they have injuries. So they've all had injuries. They've had, knee, we have multiple ligaments, ACL, meniscus tears. We've operated on them, and I cannot name who we have operated,
Yeah, of
how it
course,
works. But once that is done, so it plays a major role on their mental, capability. So they go, because sports is all, they breathe sports, and the more they are off the thing, it gets very hard for them. So that's a very tough task for us. So we constantly, that's what I've learned from my boss, that we constantly call them. So we counsel them. So we have a sports counselor as well with us.
Okay.
So it's a huge team. We have a
Yeah.
sports nutritionist,
Yeah.
we have a sports counselor, we have the whole array of sports physiotherapists. So it keeps on going, and most of them now, they know the importance.
Yeah.
Because they might lose the 6 months, but then if they don't stick to the schedule, their whole future goes for a
So
toss.
they know that.
They know that.
Yeah,
So
yeah.
I think in that way, people are becoming more vigilant.
Yeah.
And that's one of my main reasons that I need people to know how important it is,
Yeah.
to stick to the regime and get back better than before.
Yeah, when you first came to Bangalore hospitals and you were telling me, well, with me comes my team, I need a sports counselor, I need this many physiotherapists, I need this equipment, I was like, how does sports require all this? But then when I've seen you go through the patients and a lot of them go happy, I'm like, okay, there's something there in that. I'm, quite impressed with it. And it kind of makes me, understand that it's just like the team I have for aesthetics. Like I've got a nutritionist, I've got a dietitian, I've got my rehab, because after I do certain procedures, I put them on a very strict protocol to make sure that they get the best results. And I even have a wellness center in Nandi Hills that, sometimes, they want to anonymously recover. So it's a really good space. And, Dr. Abhishek, my husband, he's a spine surgeon. So we do a lot of spine rehab there also. So that team element is actually very important, because the doctor, and especially as surgeons, we're trained as leaders, but then leading a team and picking people who are extremely specialized and passionate about what they do. I find that doctors are passionate, yes, but then the paramedical people, like the physio, the diet, the counselors, all of these people are so uniquely passionate about what they do that they love to improve, they love to do it. They always stay in contact with the patients just like we do. So I think that part of it is really important.
So you know what, Larry? Actually, when I was coming back, so when I was, shifting my base I joined the Bangalore hospital.
Yeah.
So my main reason is, I think I've never told you this. I
Uh-huh.
was discussing with Abhishek as well.
Yeah.
The main reason was the team. So, it's always the teamwork.
Yeah.
It always, it's
Yeah.
never a one-man show. And as you rightly said, we surgeons we are, it's supposed to be leaders. We are leaders. But the show is always a hit when it's the whole team
Yeah.
which puts across. Because coming, I knew that, it's, I'm trained with my, sports medicine, my arthroplasty, and I have my backup for my spine. He's
Yeah.
an, celebrated surgeon, Abhishek, and you're
all
there.
right.
You're there. Come on. Okay.
Yeah.
But you're there for aesthetics. But the main thing is, as you're saying, in the hospital, the moment you enter, till the last, when you're leaving the hospital, so the most important is the compassionate care what
Yeah.
is supposed to be given.
Yeah.
And that's something what when I came in here, you remember one of my uncles was admitted at the Bangalore hospital, and the way the staff took care of it, and that's very important. That's when I say the compassionate care, and that's the right word. I remember in my residency, somebody had told me, the patient had told me, Doc, we don't need sympathy, we need empathy. And that's something I always tell, and I always resonate with that.
Yeah.
That empathetic care is so important, and
Yeah.
that is what I saw in this place. And I want to, build upon that, and I think that's the best way we can give good results.
Yeah. So it's like, I really think it's important, more than kind of bombarding on social media or putting branding everywhere, whatever. Like, one patient comes, I'm a bit old school like that, maybe because I used to grow up working in my parents' clinics and stuff like that. But, like, one patient you treat properly, that, your goodness as a doctor is gonna propagate, and that circle goes and goes and goes and goes, and that's when people come to the hospital. So you're not looking for 100 patients on day one, right? You're and then and you treat them in a way that you're scared that you may not get those 100 patients back. Like, what you want is like 1 to 2 to 4 to 8 to 16. That type of growth is what's important in a hospital.
So you mean, what you're saying is that's the organic growth, right? That's what we are looking at.
Yeah. Organic and loyal. So when I was doing my US exams and was working over there as a doctor, I would talk to kind of people, and when everyone's deciding where they want to apply, and even in India, that concept of like a community hospital, here we call it a rural hospital, that's kind of looked down upon. But my goal for Bangalore hospitals is to have a community hospital that's fully equipped. And especially in a city like Bangalore, that's really important to be hyper local. So, yes, I do have one of the best medical equipment in the country, but I really am not, I don't feel I've succeeded until, for example, people in Jayanagar, South End have everybody knows that I've got it, and everybody knows that I'm a good hospital. That's my number one kind of priority, and that's why we say, Bangalore Hospital is a hospital with a heart, because that's priority is good care. And then everything follows after that.
That's very nice. I think you always tell that whenever we're seeing we have a meeting, so you say that it's the neighborhood hospital, correct? What do you say that?
It's a neighborhood hospital.
Exactly. So I think that's very rightly said. I think it's always looked upon as community hospital or whatever.
Yeah.
So obviously we are a corporate, we're into the private sector, but then we also deal with the community. At the end of the day, service, good service, and loyalty, and we have the best, state of art, machineries, surgeons, everything. But we can give, and I think healthcare should be accessible to everyone, correct? That's what.
Yeah. So it's like there's healthcare and then there's hospitality, right? And both of those things have to come together. For example, when great hospital corporates like Apollo and Manipal started out, they also learned that quickly. We study in our admin courses and all that, so we see case studies on the way other healthcare companies have run their business, and they learned along the way that hospitality is a different vertical. So you need to have a marriage of both. And what happens is, even if the leadership on the very top believes this, as you trickle down and you grow, it's extremely difficult to kind of maintain that human touch. And how the biggest challenge I feel in a hospital is how do I translate my feelings to the patient attender, care person, and the care team around them, that they also need to think the same way. So that's why we value feedback. I send my team, the top management team, twice a day to go visit the patient, get the feedback. I get the report. So it's very regulated that way. Regulated not in terms of how much did the patient pay, did you collect this, did you collect that, but regulated in terms of are they happy? Are they happy?
That's
Are they
very
gonna
important.
come back to me? That's all I care.
That's very
right?
important. That's
Like,
very
in fact, if you ask the patients who are staying in my hospital right now, some of them like didn't pay the advances, or some of them are not paying every day, but it's okay, man.
yeah.
Like, if they like the service at the end, they're gonna honor us, I feel.
True.
I
True,
come
that-
from a family of doctors, and my parents are doctors, and my grandparents were doctors, and like, it just my great grandfather was the first doctor who graduated from Ames and came back to Vijayawada, where I'm from, and he did tuberculosis treatment for free, totally for free.
Oh wow.
Yeah, so we come from a background where that's super, super critical. And even though we kind of went into, like, my dad was a cosmetic surgeon and I'm a cosmetic surgeon, even though people say, like, oh, cosmetic surgery is so vapid and, like, it's for people who think that they just need to get more beautiful. I mean, I'm not gonna go super into it, but that's really not true. Like, any medical profession has to lead, as you said, with empathy and really feel like, why is the patient coming to me today, right? Is it just to, correct their nose just because they want a good picture angle? No, there's
Exactly.
something deeper.
Very true.
And picture angle is not a small thing, by the way. Like, if you guys saw behind the scenes, the amount of times I've been, like, correcting myself, like, it's not a small thing.
You're okay with the angle, right?
Yeah, right now I'm okay. We'll see
Great,
at that.
great,
Yeah.
great work, team. Okay. So since you've just
sorry.
told this, Larry,
Yeah.
I always want to ask this. So I think for all the people also who is seeing, so there are multiple, what would I say, multiple roles that you're essaying as a CEO of the hospital, of our institution, as the cosmetic surgeon, okay, of the board certified plastic cosmetic surgeon that you are. So I mean, I would want to know, how are you, like, I mean, they're two complete different personalities, okay, and what you're stepping in when you step in as a CEO and when you step in as a thing, how are you managing it, how are you juggling that?
I mean, it's hard considering I have a 3-year-old, but
Oh,
yeah, I'm also a mother.
Yeah, that's the
but
biggest. Yeah, I'm so
yeah.
sorry, I totally forgot that as well.
It's hard, but then I also think, like, when the more I go into it, I think, like, are the two roles even that different? Like, I think the biggest USP or unique selling point for Bangalore hospitals is that it's led by me. Because nobody else is gonna do it like I'm doing it, and as I've done it over the years, I really become confident and comfortable with that, because I really don't turn anybody away, because I don't have to, and I have the
True.
power to do that.
True.
That's the only thing that gets me going. That's the same what I do every day in my practice too. Like, I do my consults with patients for minimum 45 minutes to an hour. I don't have a
Yeah, I've seen
stopwatch
that.
or whatever,
I've seen
right? So, like, I am, like, talking to them, take the time. What do they want? How can we address it? Like, people come to you, if you take the cosmetics example, like, if people come to you for an aesthetic concern, it's not like, all right, you don't want wrinkles, let's put the Botox in. That's not how it is, right?
True.
What you don't want the wrinkles. One, how did the wrinkles happen? Are you constantly like this? Are you constantly like that? So I study their face for a while. Like, even sometimes, like, a month or two, I'll go into being like, take pictures, show me where the wrinkle is, even just for the 11s here. Like, it's not that easy, because that same muscle goes all the way here, and there are people who don't want this side blocked and they want to keep that natural facial expression. So sure, it's a 10-minute procedure, but it's also like, you need to really, really, really know the facial anatomy, study the specific anatomy in the patient, know them personally. Is this somebody who's always camera facing, or is this somebody who's going to social events a lot? And that's two totally different things, right? So you can't come and say, like, I want my wrinkles gone. For what? Right? Like, is it to be on the cover of Vogue, or is it to be the most beautiful looking 60-year-old?
So there's a lot of
Yeah.
reasoning for everything, right? That's what.
Yeah.
Yeah. I mean, it happens in everything. So so as we start, doing things, it becomes, we're so used to operating.
Yeah.
We do 3-4 cases a day. We see like 20 25 30 OPs a day. It becomes monotonous, which should never be, because that's what I was just telling the other day as well. I was just telling there was an observer who had come, so I was telling the young chap that, you guys are so used to it, you don't question that why is the patient
Yeah,
here,
yeah.
and what is that, what we can give, what is the solution that we can give that he'll be happy. So we are so used to, they'll come, okay, fine, okay, you have pain, okay, show me your knee, okay, I'll examine, 2 minutes, tuck, x-ray done. But I think we need to spend that time, because
Yeah.
the patient, all they yield or they look forward is time.
Yeah.
And that's very important, as you're saying, that
Yeah.
that comes, and that time gives you the reasoning, that
Yeah.
why and what.
And I think that's going back to why I think that Bangalore hospitals has a unique outlook, because I take 45 minutes to an hour on my consults. So I'm not going to control my doctors
True.
or
Very
like
true.
finish it now, finish it this, or like, you need to see this many patients. Why are you spending this much time? Those metrics all do exist. It's not that they don't exist, because, ultimately it's a business. It must run, those kind of things. But time is so precious.
Very important.
Because
Very.
there's also, there's a study, a couple of studies done in the US that's evidence-based and fully researched over time. How much does the patient actually remember at the end of a consult? So, like, not to say that they don't have memory power, but that stress. So stress, white coat syndrome, where you're in front of a doctor, you're anxious, and the studies show that, like, they almost don't actually remember
Oh, really?
what
Oh.
we say. So that's why
Holy
the
mother.
note and the prescription is so important.
Okay.
So I don't write in the file most of the time. I have my iPad, and then I like type everything that I'm saying. I'm a fast typer, but
I still write. I'm an old school, you know that.
Yeah.
I write, but also, I mean, I document it very well, but
Yeah.
I cannot type. I write it.
Yeah. So when I write my note, I don't write it like I'm a doctor writing my observation of the patient. My whole note is structured and tailored to make the patient be able to read it, understand what I'm doing. So we write it together.
Yeah.
So even sometimes, like on my iPad, I have a picture of their face. I put the face in there. I mean, I'm giving my tips and tricks now. So I'll come to me and you see how I do.
Yes,
Yeah.
I think it's it's very easy to come as
Yeah,
well. We have the
yeah.
metro
Yeah.
right away. So yeah.
Shameless public service announcement. Yeah. We keep you in the loop. My kid or me are doing sports, blah, blah, blah. You've got us covered. But unfortunately, an injury happens and we need to get it taken care of. And I'm guessing because I do have you in the loop, you would tell me when the injury is pretty bad. So what is the surgical part of it look like? Because I remember in PG, like every time I'd look through the window, so we would be on opposite sides. The general surgery OT was this side, and
I knew this would
sports
be
OT
coming.
would be that side, and literally I would be like, doing all sorts of cases, and I'd go there to like talk to Prathik, and he's just like holding the leg up for the professors to do the thing. So I used to like, joke around that this guy literally, doctors, they're just like everyone else.
So to give a context, guys, it
Yeah.
was in the first initial couple of months of our residency.
Whatever, it
and
happened.
Then, and you know how orthopedic surgery is. It's all about,
Yeah.
it's power. You have to be lifting, traction, and all of that. So it's a lot of drilling and throbbing. So all of that,
Yeah, yeah.
that. So let's not go
Well,
there.
no, then I didn't realize that you actually have to give counter traction.
Exactly.
And that's what you were doing. To me,
Exactly.
it just looks like this guy, he's just holding the leg all day long for hours.
Yeah. That's what initial
So,
years we all
yeah,
thought.
yeah,
Initial months. So
yeah.
yeah. So coming back to your point, Lahari. So basically, I mean, our main bet is surgery, right? You know, orthopedic, arthroscopic surgery or sports surgery. So, I mean, a lot of people do that. It's not like, it's not like an MCH course. So we do fellowships under trained people. So what's important is the timing of the surgery and obviously the surgical pearls, how we do it. Okay. So any ligament or anything, it's all in they are literally like, when you're playing a chess. Okay. So how the queen is being, completely safeguarded. Okay. So it's basically like that. Your bone is very precious. It's very pristine. So all of these, the ligaments, rather it be your knee or your shoulder, they all safeguarded. So we ask, instability, buckling. I mean, they're all very scientific terms. When you come to a doctor, we'll talk about it. So when that's there, clinically you have symptoms, you come to us, we're going to help you with that. So I believe, and I've been taught that way, that we never go by MRI. So, obviously that's the main leading factor for us, a scan, which says that, okay, because these are all soft tissues. It's not picked up on the X-ray.
Okay, so for clarity, bone is CT and soft tissue MRI.
Yes, exactly.
Although you can see soft tissue. Have you studied RCT about how the soft tissue is in the CT?
I just did. Yeah. I just did because one of my patients had gone and I just did that and I mean I was amazed.
Yeah, you can see the ligaments and everything.
Everything,
right?
everything, and so fast.
Good.
So that when we see, so I always say that clinical examination is very important. Once we do that, what we do primarily is an arthroscopic surgery. It's a keyhole surgery. So how you do with laparoscopy, it's very tiny, max to max 5 mm stab injuries. We have multiple keyholes. We do the whole surgery, and then usually if it's not that severe a thing, the right next day we start the rehab. Again, those are my pearls. I'm not going to let out here. So when you come, we have a whole structured, so basically it's tailored program for everyone. We don't believe that okay, you have this ligament tear, all of you will go with this physio.
One size fits all. No,
you are very, how is your muscle, how is your muscle tone, how is your whole functioning. So we tailor a program for you and you're in constant check with us. And then we start with all multiple things, because people have a lot of misnomers and you can't really go on, because the more it's easily available, I was saying, the more people are aware of it, the more there are a lot of misconceptions. Like you can't walk for 1 month, you can't play for 1 year, you can't go there, you can't go this. So it's a lot of things. So that's where I say that go to the certified, so whoever it is, surgeon, and you get treated the right way, so that you don't miss out on all of this. So we have a lot of people coming. Somewhere they've been treated XYZ place, they come to us, they say, doctor, I'm not able to bend my knee. And I say, okay, how long has it been the surgery? They say it's been 6 months. I said, your whole knee range is gone.
So why do you think?
Because they put on a long knee brace, what we call, and they say don't bend, because your ligament is going to again break. That's not going to happen. If the surgical step is the right way, then obviously nothing's going to shake unless until again there is a tear. So obviously we work on that. So all of this is very important. So surgery is just not surgery. Surgery is it's a very holistic approach.
Totally.
How you clinically evaluate, how you read the MRI by yourself, how you go to the OR, how you do the whole process, and how you follow up with the patient.
It's like each patient is a case study.
Exactly.
And sometimes, after I do like a filler or a Botox or post removing rhinoplasty dressing, like I get scared that the patients think I'm weird, because I just love pictures from them. So I ask, like, every night after you wash your face, just send me a picture. But then I do it. I don't want them to think I'm crazy, but it's so important to see how it evolves over time for them.
I think it's that extra care what we give them.
Nothing is one and done.
Nothing.
It's a relationship between the patient and the doctor. Like, I mean, I won't be crazy and say we're friends, but I mean, it's a pretty intimate relationship between patient and surgeon.
And I think that comes with the trust. So when you hold that relation, you just they're not just one person. They come, you finish suture, out, you're done. Your job just starts there. I think it starts there. Don't you think so?
The mechanical part is almost the easy part. I mean, it's easy only because we've done it so much and we have the training and everything. But then the talking to the patient and making them feel, because see, like, no one patient, no one surgery is alike. No matter where you go, which
Very true.
specialty, it's never the same. It's always different. And in plastics, that holds so very true because everybody is different. Every problem's different. Every skin is different. Every muscle size is different. It's like each patient you create totally differently. So at the same time, there's also an entire spectrum of environmental problems, right? Like after the surgery, I could have done something absolutely perfectly. But if the patient doesn't help me and follow my instructions and keep in touch and do all that, there's a scope for a lot of post-surgical issues that can happen. So we need to, that's why I'm very, very particular that after surgery, like I tell them straight up, like 50% is the surgery, 50% is following my instructions after. And it's not just I write the instruction you take. Every day send me a picture. Every day do a check-in. And if they forget, I check in because I love to do it, and that's that critical for the outcome.
I think I also I'm on the same pages of same page as you say, because because for us picture doesn't make any difference, obviously, as the thing, it's how they rehab. But I have a lot of patients. I want to ask the same thing. I have a lot of patients who come from out of the city. They're not from Bangalore, so they might not come for their follow-ups, which I'm very keen. But if it's difficult as well, I make sure I keep a video consult. I see how is it going on, or else if I trust someone who is one of our colleagues, so at least they see in that place, they get me on a video consult. I see them, but at least they need to come, because surgery is just not a work of the surgeon. As you rightly said, how the patient comes to follow our what we say, the protocol, because if they don't do, at the end of the day, we need to do justice.
We're both not happy.
Exactly.
It's not like, so one other thing is, like, when a patient does have a bad outcome, like, it doesn't mean that we're both not happy.
Exactly.
Right? It's not.
Does it bother you? Like sometimes I feel like I'll be like, damn, I wish he had just listened to what we told.
Yeah, but you can't say that.
Exactly.
So it's a bit.
It's
the minute they get discharged and maybe 2-3 days after, they start feeling happy, comfortable, nothing happened. So that kind of laxity steps in. So it's our job to keep on.
True.
So at the risk of you thinking I'm creepy and a stalker, I'm really going to be after you if you're my patient, to make sure that that we're both happy, because it's a very emotional thing, honestly.
I believe
I get that knee replacements, hip replacements, they happen like so often. I mean, I see a lot of ads from other hospitals, because that's kind of my side hustle, is that I look through what all the other hospitals are doing. But people are doing replacements like wild. And even I don't think age is a factor, is it?
Age is definitely not a factor at all.
So young people also.
Young people as well. So it's basically your clinical symptoms and how you are with. So there are two different set of notions what we believe at. So one is age is not a factor. So before it used to be like, replacement, your knee is getting replaced. You can not have in 10 years the knee is going to go away. Nothing like that. We have amazing, good, scientifically designed implants, so which we put inside. So that's going to go for a long time. You're happy, you're doing all your functions.
You don't need to get those exchanged if you're young?
No. So there are multiple things. That's how it's coming. So we have something called as a partial knee replacement, what we do. You don't have to replace the whole knee. You just replace one side. So you have the inside and the outer aspect and the inner aspect. We replace only the inner aspect or the outer aspect. So that's called the partial knee. Again, there are a lot of indications, only if you are indicated for that.
Is there no way to kind of, especially when kids get hurt young, or they need that, like people are telling them to do replacements, is there no way to kind of use the bone? I mean, why do we have to? Because see, plastics is all about reconstructing, using native things and trying to make the most of what we've got without. So one of our tenets is actually to never discard anything.
True.
So I find it crazy that there's so many replacements going around, you're just kind of removing the bone. Is there no way to kind of use your own bone?
I'm so glad you asked this,
Yeah.
Larry, because this is actually, I think it's a need of an hour, so we need to address it. So always and always your native joint is better. So when you have your own
Yeah,
joint
yeah.
is always better. I mean, because you don't have restrictions.
Right.
Whenever you have replacement, there are certain restrictions. So I've been lucky enough to be trained under this exactly same thing where we call as corrective osteotomy.
Okay.
So it is where we are safeguarding your own joint. So it's in your knee joint. So say that a person comes XYZ walks in to my OP at he's 45, okay, and he has knee pain. Same, his meniscus is torn, and but his bone is good, okay, but he has slight varus, what we call the bend. The bow.
Okay.
So there are, the constitutional varus that's by birth, and also there's pathological as well. So in such a case, what we do, and also that was the main thing when I was coming, like when I was joining the hospital, I told you I need this specific X-ray in our setup.
Scanogram.
Yeah, scanogram.
I thought that was a very simple thing, but I guess it's quite complicated.
Exactly.
Yeah.
So that we get it done. So we've been doing it, running it.
Yeah.
So we run that, and we have a specific app which we upload the patient's scanogram, and we go through their angles. So we have all axis, your whole, because you're standing erect.
Yeah.
So we have mechanical axis, anatomical axis, all of that. So I calculate them and how much is it's off loading, and mind you, if the cartilage is good, okay, it's not, we have multiple scoring as well. If everything falls in place, then I do something called as a corrective osteotomy. Okay, that's a huge thing. It's a new thing which has been very less people do it, and then we've been doing it quite regularly.
Yeah.
So when you do that, you're going to correct the alignment, and you're going to fix it with the plate and screws, and you're good to go from the next day itself. So what helps with this is you'll have your native joint. Say if you would be getting your knee replacement at 50, at least we can push it till around 55, 60, easily at least 15 to 20 years.
Really?
We can prolong it.
But will you eventually land up in a replacement, or is there a way to?
Not really.
Okay.
So if you safeguard it at the initial stage itself, so we tell you for activity modification, a lot of other things as well. But if you do that right, you might never have to have a knee replacement in future.
Okay.
But also all this, at least till 70, 75, you can lead, like you can squat, you can sit down, you can hike, you can trek, you can do all of that, which in a knee replacement there might be some restriction.
Oh,
I wouldn't
really?
say
Okay.
all of it, but there would be some because it's
yeah.
not your native joint,
Yeah,
right?
yeah.
You have an prosthesis, so the wear and tear would happen more again with that as well. So that is very important, and that I think people need to be more aware about it. That's why I was saying, we need people to know that there is something which is in between where you can go for it and prolong, or you can never have a replacement in future.
So this is a new thing, like, is it?
It is quite a new thing. It's been in the Western countries, it's been there for I think 10-15 years. But in India again, it's been there. Couple of pioneers are there. So, but it's very helpful. It's very helpful, and if done at the right method and thing, patients are extremely happy.
Good.
So I think that's exactly the answer what you were asking for.
So, and what other new things are there? I mean, I went to China and they were like talking about a bunch of different kinds of implants. Are we getting any of that stuff in India?
We do. I think.
What's the newest implant we're getting in India?
Medical field in general, it goes hand in hand with technology.
Yeah.
So it's just so many things are happening. So we primarily deal with right now, robotics as well. So it's all over the place. We do that. That's been helping, and I've been on a study where I've been doing about AI study. So it's not just surgical. So I've been in talks, getting a app developed. So once you come, get admitted and get discharged, so your name gets enrolled. So your app is there with the patient and the doctor. So
in the implant?
No. It's not in the implant. So those are there as well, but it's not still, the R&D is not in India as such. So what we do is it's on the phone. So you have any problems, like you keep checking. So doc, this is my knee, my swelling is like this or something. So you have documentation. So it's very easier because as we were talking, so and anything, you have pain, you have multiple scores. So if you want to see how it's going on in future, maybe after 10 10 months or maybe 2 years, you don't have it.
Yeah.
So right now we are developing that app. So hopefully, it should fall in place,
very
and
cool,
that'll be easier for patient, and for patient documentation, things are going to be much easier.
Okay,
Yeah.
very nice. So you're really focused on the rehab part of it as well.
Yeah, rehab part of it as well. So I think, artificial intelligence is all over it. So I'm sure, the only place where AI can't take over is we doctors or surgeons, because at the end of the day, we got to be there.
Yeah,
on
you
field.
think so? Some people say that we're gonna get. I went to this conference on medical AI, and they were saying that the last thing to go is a barber, and the second to last thing to go is doctor, a surgeon.
I don't think so.
Yeah.
And I hope AI don't take over us,
Yeah,
because that's
we
the only
literally
thing.
studied forever.
Exactly.
Like, at least wait for our life cycle to be done.
Well, I don't think so.
Yeah.
I think that's very important. Larry, I want to ask this actually.
Yeah.
So we were just talking right now that how much it's important that when you deal with patients in general,
Yeah.
confidentiality is a big thing. It's a huge thing. So I've been seeing that on social media. I'm not pinpointing at someone, but then usually the plastic surgeons or the cosmetologists or whatever, so they put this, although they blur the faces and blur the things, so but then there's a lot of this on Instagram, how they put right on social media as that before and after and all of that, which I don't see you doing quite a bit. Okay, although you have a lot of patients, but you don't put it out. So is there a reason? So is there something that you believe, and what is it? What goes behind that?
Yeah, that's actually a really, really good question. And it's something I struggle with actually, because practices do get a lot of patients based on social media marketing. And one of the biggest modalities to market their service and their outcomes is definitely pictures, especially in cosmetics and plastics. Like, the outcome is seen. And that's what makes plastics such a challenging field actually. Correct. Because everything is visible. Exactly. Nothing is hidden. So we are that's like a very popular way. If you look at any Instagram account, like, it's mainly just frames of patients and outcomes and whatever. But I just feel it's going back to that thing about empathy. Even though I'm sure everybody else gets a written consent. By the way, if you are being featured on an Instagram page or any kind of social media, there has to be a written and informed consent, a media testimonial consent. So make sure that that's done. They have to have your permission before using your images, for sure. And you have the right to say no. That's another thing. Please say no. I wouldn't think anything if a patient says no.
Exactly.
Because you have to respect that, and it makes sense.
Very true.
So yeah, I think it goes back to empathy, because even after giving consent, sometimes I feel like if I do a breast lift, and a lot of people on social media, they'll blur the nipple of the breast, or they'll put a sticker on top of it. It's still the patient's breasts, and putting a before and after, it's like, they've come to you because they're extremely self-conscious about this. And then, yes, we've done a great job. And yes, it's a learning for other people. Yes, you're right that it shows the community that, hey, a lot of people have different types of issues going on and we can fix them. But, I don't know. For me, I feel like I don't do that. I more like I use written this thing where they may say that, I had a good experience. And so I say that helps me, because it shows patients that, people are having a good experience with me. But other than that, I really try to stay away from showing the pictures. If you come into my office, and I've had patients say it's all right to show these images to other patients who have similar issues, then in the office I have like photos that I show you.
Okay.
Just to give you an idea, but I really don't like to kind of put it on.
Actually, I think it's a very dicey thing. It's a very double-edged sword thing, kind of a thing. So I think it's up to each person's, what objectives or principles.
Yeah. And great question. Takeaway from this is that different people do it differently. Not that my way is better than the others in terms of how I present my practice and my services to the public, but Takeaway is like you have all the rights to say that, listen, whatever you do, I don't want my photo out there, and I don't want my face out there, and the surgeon has to respect it. So I think that's yeah. And I don't think so any surgeon would like treat you differently just because they can't put the photo out there. Honestly, I speak for the sisterhood, brotherhood of surgeons. Like, that doesn't matter.
Yeah, I don't
like,
think
we're
so,
gonna
no, but
treat you the same whether
exactly.
you can put the photo up or not. Because the first thing for us is do no harm, and the second thing for us is get a good outcome at any cost. So that's okay.
That's good. So coming to this, Lahari, I remember last year, right? I think last summer, you had been to the US for this. Just tell me more about that. You know, there's this huge conclave of rhinoplasty that you had been to.
Oh, yeah.
So what was that? I mean, how does it work? Since we're just talking, I thought, no, I'll just ask because I was just curious. So how is it different, or is it the same? What do you do, or how does it work?
So this is the American Academy of Cosmetic Surgery, and we submit our papers and our proposals, and my boss, who I worked with, was one of the first cosmetic surgeons in Bangalore, and he also would practice in Jayanagar, and Dr. Venkatesh, and he started he's a really innovative thinker, and so this is my boss during my training, and so he at that time started doing rhinoplasty in a different way. So far, there are two ways of doing rhinoplasty. There's open technique, where they lift the entire skin up, and we can do a class on rhinoplasty later, but basically it's open and closed, and closed is when the incisions are hidden inside the nose, but there are challenges with both. So if you're hiding the incision inside the nose, you can't actually get all the corrections that you need in your, we call it our toolbox of corrections, because every nose is different. There's the hump, there's the tip, there's the ala, there's the side. There's a lot of things going on. So he devised a way over time where he started with a closed approach. And if the goals are met through the hidden incisions, fine, good enough. But if we needed to develop it further and take it an extra step, then from there we can go to a open approach. So when I was working with him, I really picked that up, and we both submitted papers for different journals about the sequence and the technique, and we really refined it, and we call it the inverse hybrid technique. It's good because it keeps the options open for the patient. Otherwise, what happens is they go, okay, I want the incisions inside. I want a closed rhinoplasty. They come in with that. And no surgeon wants to say, well, I can't achieve this in a closed thing. So you try kind of in the dark sometimes to get that done, and the result is not going to be as striking as if you had gone open. So this gives the surgeon and the patient flexibility to say, let's do it in a graduated way. Let's start closed, see what we can do, and let's go to an open with very hidden incisions. And if that's required, that's where we'll go. We're not just going to a surgeon who only does closed or going to a surgeon who only does open. You got to have flexibility. It's a hybrid procedure. Yeah.
But since we're talking, what do you think? Do you think my nose is good? Do you think my nose needs something?
So he recently got engaged, and I made a speech at his engagement, and I said that, hi, I'm Dr. Lahari. I'm Prathik's plastic surgeon.
Guys, I've not got
because
anything.
I have done his nose, everyone. His nose is perfect because of me.
For the record, tell people will think that.
Yeah, no, he does have an excellent nose. But the rest you have to pay me, and I'll tell you. There are a few tweaks. All right, so the team has put together one of the most searched Google questions, a few of them, for each of us. So let's get into it.
Sure, let's dig in.
What's the most surprising thing you've learned from your patients during their recovery?
So I think the most surprising thing I've learned is, initially in my initial days, I used to think patients are like, they're not that keen. So what they want to do or how they want to be seen, unless until they're not a professional athlete or something. But none. That's what I've seen. There is, 80% of them have great diligence. They want to get back in their thing and they're very particular about that. And that was actually surprising in a very great manner. I was like, wow, that's such a great support. And then I think that's how it worked well.
Yeah, that feels supportive for you too if the patient is
Correct.
into it. So can you share a memorable light bulb moment in your career that changed your approach to surgery?
So coming to surgery in my field, how I've done, I think my light bulb and like amazing, my whole change which took was my training period back in Pune, and then again I went to I was in London when I was doing my diploma in sports medicine. Those times they were actually like they've changed my perspective, how I see the whole perspective about outlook, I would say, about patient care, surgery, the meticulous thing that has changed the whole phase of training period.
What's the most rewarding aspect of your job?
I think, this profession for me, every time I think about that is when the patient comes back and maybe, if I fix a ligament or I replace a knee, so they come back and after say 2 months they're able to walk, and the pain, that agony is gone, and they say that boss, you've actually given me another second life. Not that I look for their justification or something, but it feels good. I can go back to, when I go back to bed, I feel happy. I'm like, okay, I have done some difference, there's some change I've gotten into someone's life. That's really rewarding.
All right, and how do you stay updated with the latest techniques and advancements?
So basically, I would be speaking on behalf of all my peers, all the doctors. So it's never like you finish, you're done. It's never a thing. Although we toil and study for like 10 odd years and more than that, but it's never the end. So we keep I keep doing the research. So in a week's time I have a stipulated time where I do some research work. I see the new advances, how is it there. We keep seeing new videos, we keep attending a lot of congresses, conferences, see what's in new, how can I inculcate with my population, how can that benefit my patients. And it's a continued learning process. It never ends, and I think that makes us stay updated.
How do you handle pre-surgery jitters from your patients? I'm sure they're nervous. Every patient is nervous before.
Yeah, that's a very, very, very good question, and I think it needs to be addressed well. So most of the patients have that, and they have a lot of questions, a lot of queries, and I usually get this asked. The patient after some time they're like, "Sorry, sir, we're asking a lot of questions," but I say that please get yourself cleared properly, and whatever queries you have, you should always be cleared before the surgery and be in a fresh state of mind. Otherwise it's not going to happen. Say we go to we buy stuff, and any normal thing, you have so many questions to ask. Come on, you're doing something, you're getting it operated on your body, you have something happening, so you need to know everything. What, why, how is the the prognosis, what is going to happen. Because unless until you don't, if you have that query in your mind, then you'll have jitters, and then the trust factor plays a role, and it's going to get not that healthy kind of a thing, the whole process. So I sit down to the patient, I tell them in detail, I have my materials, I show them what it is, how it is, and throughout the process I am there like a like a friend, like a brother, so that they can have that connect with me, speak to me. And I think, touch wood, they're all doing great. They all, I think I can speak for them, they all love me.
It's so difficult to actually pick your doctor. I mean, like, how can you actually tell, like, okay, this is the guy? Because there's, from our end, when I pick a doctor, it's usually word of mouth from my doctor friends, but that's because we have the community. But how does the person who doesn't have a doctor in the family or doesn't have such an intense community of doctors, like, how do they pick?
So actually it's a very good question, because right now there are a lot of doctors. Everyone's a trained doctor, they say, and they're on every street. So how do you pick a right doctor is very important. So I don't, now people usually go for reviews, they see all of that, but one is, you should always, when it comes to healthcare, you should know someone who has been there.
Yeah.
So who have the trust. So go there, meet them, and it's your human touch how you have with the doctor. You need to have that trust, and once you have that trust, once you feel you're comfortable, you're in the right hand, I think that that does the work. So that's very important. See, other things, the reviews and all of that, I'm not going to go into it, but it can be hampered. But the actual somebody showing you result, giving you result, that can never be hampered. So pick wisely, see what they're done. I mean, how they've trained, where they've trained from, what their whole schedule is, how it goes. So do some research. It's always better.
Feel free to ask the doctor where they've done their training, how long they've done their training. Because doctors also want to talk about it.
Exactly. Yeah. So it's very important.
If you see, don't feel off spot to be like, hey, but how long did you work there? What did you do there? Why is that place special? Is it special? You don't have to do all your research on the laptop. You can actually come to us and talk to us and figure it out with us. Are we the right fit for you?
True.
Because honestly, if a patient comes for a gynecology problem, I'm a plastic surgeon, so I'll definitely help her scars heal properly and suture nicely. But at the same time, I'm not gonna, just because you came to me, I'm not gonna do the surgery, right? But I can direct you to somebody I know who does a fantastic job, and we'll both take care of you together.
Exactly.
It's a collaboration. It's not like if you ask us and then I want you to only be my patient, so I won't introduce you to other people. Use your doctors, lean on your doctors to get in touch with other great doctors, vetted by people who know what they're talking about.
Very true.
Yeah.
I think that's true.
If you weren't a surgeon, what other profession would you choose?
That's a good question. So, I mean, there are a lot of times where I've thought shoot, what am I doing here? I should just leave this, because there's so much of, every profession have that. But I think right now I'm so content that I'm a surgeon. I wouldn't be anything else. But yes, passion wise, I love dancing, so I'm into art. So I'd be something in that field if it was passion. But right now I'm so content with what I'm doing, and I just want to keep doing it more and more and work more on that and be happy and be really, really content. So if your surgical techniques had a signature cocktail, what would be in it?
So that's a really good question, especially considering you said the word cocktail. So I actually refer to a cocktail of custom answers for each problem, because aesthetics is every face is different, so you can't just come in saying I want Botox. You're more coming in for a problem. For example, if you've got a line, a crease, and you do the Botox, it's only going to relax the muscle underneath. But if that line is properly etched in, with the muscle contraction being paralyzed, it's not going to actually get rid of the line. Sometimes we use collagen threads, sometimes we do microneedling, sometimes I just put them, if they're young, put them on a regimen of face rolling. So it's like I said, the toolbox, the surgeon's toolbox, an aesthetic surgeon's toolbox. That's why it is actually advantageous to go to a plastic surgeon, because our toolbox consists of a lot more tools, because we have the entire spectrum of surgical solutions also. So you can do non-invasive, and I do non-invasive, but sometimes you do need a bit of surgery or to get that proper solution. So I would say for face, a little bit of Botox, fillers, microneedling, PRP, and then as time goes on, a proper facelift. So it just depends.
So if you could invent a procedure that doesn't currently exist, what would that be?
So right now, a lot of the breast procedures, we do it in a minimal scar way. But there's a lot of scope, I feel, for improvement in terms of scarring, especially when you're just doing a lift and you're not actually reducing the breast volume or augmenting breast volume. So that's maybe a sort of scarless internal bra is what we're looking at, yeah.
So Lahari, if you were to write a memoir about your experience in aesthetic surgery, what would the title be?
Now you see, now you don't. All right. Thank you so much. Today we had a great time with you, Dr. Pratik. So happy you were able to make it. I learned a lot about sports medicine and a lot about you as well. And I hope you learned a lot about plastics. So we've got a lot of exciting things coming up in the next few months. We've got a lot of good, great doctors who want to talk to you about their specialties, about their lives, and how they handle everything. So if you really loved hearing about us and how doctors are behind the scenes, please like, share, and subscribe. That would be a great support. Thank you.